All right, welcome Dr. Navdeep to our IMG success story session. And first of all, congratulations for your massive result.
Thank you,
And
sir.
all of us here, whoever present, and also me, I want to mostly me, I always want to know about your the previous works or the previous things that you have done for this exam and how you have made it through, and now you are in that state, you are sitting and you are sharing your success stories with us, so it's always fascinating for me. So I want to hear from you, like when you have passed your part A, how much time you have taken for your part B preparation. What are the, different candidates take different strategies to go through this exam, right? So I'm always fascinated by those, and I always try to compile those things for the future candidates so that they can follow and they can also crack it down, right? So yeah, share those things with us as well. So you can share your score as well with all of the future candidates if you want to. So the
Sure,
time
sir.
is yours, Dr. Navdeep. So go ahead, share your experience, share your success stories
Thank you.
with
Thank
us.
you. My name is Dr. Navdeep, and I'm from Delhi, India. I'm an orthopedic surgeon currently. I gave my MRCS Part A in January 2024. Uh, Therein, I got a score of 277. So I passed it there, and basically from when I passed the Part A, I asked whoever had given the Part B as to what is the best time, dug deep into the resources and everything, and found out that it is best to give Part B as soon as you clear Part A, because some of the knowledge stations are similar. Back then, I did not know about this knowledge and skills, but I just heard it roughly that you should give your Part B as soon as possible. It is the best. So then there were no slots back then, but immediately I saw that Mumbai, India popped up at the RCS England, and I had given my part A from RCS England only. So I thought that it's best, and the formalities were also taken care of because I had already registered in RCS England. So I booked the part B, and one of my strategies for taking any exam is to first dive deep into all the resources, all the videos, all the YouTube, Telegram, whatever if on the entire planet Earth is there about things. So while doing that, I chalked out what was part B exactly, what is knowledge, what is skills, what is everything, and I found out two videos. Coincidentally, IMG success stories only. One for Dr. Sanika, who gave Mumbai in December 2023, I guess, and one was her partner only, Dr. Chris. Two videos came
Chris,
side by
yeah,
side.
yeah.
Yeah, so I while I was driving home, because I have like a 40, 45, 50-minute drive to the hospital. So I was listening to those videos one day. I heard the entire video and I really liked it, to be honest. So I went on and I researched
See,
about your
see, Dr.
course.
Navdeep, one thing is about these success stories. These are so touching, right?
Yeah,
Because you guys are sharing your honest thoughts. This is not say something good about me or say something good about the IMGs and all that stuff. It's not like that. It's like sharing your basics, like sharing your actual honest thoughts about your journey, right?
exactly.
So yeah, I think that's the most important thing, that it should touch the other candidates, or it should embrace them in a real way, not in a fake way. Like you just have to say something good about the
See,
IMG
definitely, you
Academy.
are
It's not
absolutely
like
right.
that,
You are absolutely right.
right?
That
Yeah.
those
Okay.
videos, both the videos, and especially Dr. Sanika's, was so genuine and honest that I had to research
Mm,
about you and your course. That is, I went
mm,
back home and I researched everything, and I found out about. And I think it took me like because see, I did not have any seniors who had cleared part B, so I did not have any guidance in that regard. And in orthopedics, in our area, at least in the
mm.
hospital, very less people had given part B, let alone part A. So I went back, I researched, and I think it was in March 28th, 29th, I messaged you personally on Telegram, and I asked you about it. And I joined the course. So straight away, I asked you whether I should take the books or not, and you clearly said no need for the books because you have just 3 months remaining for the exam. So don't take the books. And you were very honest about it that you don't need the books because now I can understand why I did not, because you said that it took 1 month for the books to just reach the desired location. So
Right,
now I
exactly.
get
Like it will not make any sense, right? You have only three
exactly,
months in your
exactly,
hand, and I don't want to
exactly.
sell like that, right? It's not about
Definitely,
selling the
definitely.
things.
Exactly,
So,
exactly. So that was very
yeah.
genuine and honest of you. So and then you gave me that drive and everything, and that was magical. To be very honest with you, because before that I did not have any guidance of sorts. And
Mm.
after that, I started my preparation in April, and I had this April, May, and June. So 3 months I prepared uh, with the and the
Tough,
soul.
tough. It's very tough.
Yeah, and the sole my sole preparation was through your videos and one of the textbook that is very famous that most of the people read. So these two things were my main. And what the thing was that my job was my hospital timings are basically it starts at around 8 and ends sometimes in the evening, sometimes I have 24 hours. So mostly I was not able to take part in the mocks, and I was very sad. Many a times I was like feeling that well, am I missing out of something, or am I not able to? So I used to listen to them. I used to listen to your videos. I used to listen to your mocks, and as the time passed, mocks ka bhi time thoda, I could not even listen to the mocks. So I just went to your
Mm.
videos basically, the previous years and everything. But let me just tell you, they were my main source of preparation, especially the skills. And hats off to you, sir. The way you have explained history is amazing. And see, because we have studies those things such as acute pancreatitis and urinary retention and BPH and
Mm.
everything way back when we were in medical school, basically. And at that time also, we did not know how to do it correctly. So now with the clinical knowledge and with your videos, I could revise or get those things back very quickly in my head. So
Mm.
what it was my daily routine. I just used to like start my car and start your video at the same time on my iPad.
Like
And I used to
one
listen to your
joke,
history. History
or
taking was a routine, Dr. Atik.
uh, one joke, Dr.
I'm
Navdeep.
sorry, I'm not able
Some
to
of the
hear you.
candidates,
Okay,
you
just a
can
second.
hear
I'm
me now.
sorry.
No problem.
Yeah, I can hear
You
you
can
back.
hear me now, right now. Okay. So, Dr. Navdeep, just
Yeah,
a simple
I can
joke.
hear you. I can hear you.
So sometimes one of few candidates say like, in my dream as well, I was hearing your voice. Okay, so
Yeah,
it is just
definitely,
like that.
definitely. And I had the BPH station. Coincidentally, I had the urinary retention station, and I completely remembered your, the like we do
Sequence,
naturally. We go to the washroom and
the
we hesitate,
sequence,
and
yeah,
then
right, right,
the entire thing was so smooth. I cannot even tell you. That was really nice.
yeah.
Same was with the clinical examinations. I had no friends in the basically the biggest drawback with me was that my best friend was preparing with me for the part B, but his exam was in May, the RCS Glasgow
Oh,
Delhi one. So I did not have a
mm-hmm.
partner for the entire May and June. For 2 months, the last, I did
Mm,
not have anyone to practice with me. So the sole source of my skills was your videos. I repeatedly watched and watched and watched while driving, while every time. So in the end, I just I could see you doing those varicose veins again and again, those three raising the leg 3 times, and then I. In the end, it was just clockwork. And to all the
right.
candidates who are preparing, I understand that practice is important, but don't get disheartened if you don't have a partner. You can search for an online partner. There is no problem. But if you do not have even that, let me just tell you that I had no one for 2 months. I just watched your videos and I just made it in my head. I used to
Right.
practice on my brother or something, but in the end, it's okay. It's going to be all right as long as you follow the
So, just one thing to add, Dr. Navdeep. The
def-
human psychology is to carry the memories. It has different, like, different sorts of things. Like, uh, suppose you are practicing just by watching the videos, right? So whenever you are going to give the exam, you will carry those synapsing just from those videos, right?
definitely,
But maybe some of the other candidates are practicing with their partner, so they will carry that moment as a memory. So
definitely,
it exactly means like it doesn't matter. with whom you are practice or from where you are practicing. It's about the repetitions, right?
Definitely.
Is it enough that it can just blink during your real exam? Am I correct?
Definitely.
All
Absolutely
right.
correct,
Okay.
sir. Because I see many of these people, asking for study partners on these groups again and
Right.
again and again. I see the
Even
same
even
memes again and again and again.
right.
And
Right.
I am literally saying to them, Madam, I want to say to them, see, I am doing these examination videos, and I am repeatedly, making a muscle memory in my brain, at least in the neurons of my brain. So rather than
Uh,
asking for those and making it as an excuse that I don't have a partner or something, just start doing it again and again and again. I think that would be better.
right. Right. So anything you can say about your exams specifically, like anything you have faced difficulties, how you have managed your stress, what are the things you have done just 1 or 2 weeks before your exam? What about the night before the exam? How was your exam day? So yeah,
Definitely.
something like that.
For the preparation, I would just say that knowledge and skills are both equally important. I understand that skill is the more feared of the two, because you have to perform
Mm,
certain things. But knowledge is
mhm.
equally important. So do not skip on the knowledge part, because I did this mistake. I left my pathology till the very end, saying that I'll do it, I'll do it, I'll do it. Let me just focus on skills again and again. So don't do that. They are equally important. You should focus
Mm,
on both. And my suggestion would be to do one knowledge and one skill, one knowledge, one skill station. That is the best thing, because you don't get bored also, and you
mm,
complete everything side by side. That is
mm.
one thing. And in the last 2 weeks, basically just revise and revise. And sir has that magic notes. Those are very nice. I
Mm.
did those one day back also, and in the morning also of the exam, I read those notes for the clinical examination. They were superb. And because I had watched a video so many times, so I was correlating everything with that. So very easy to read.
Right.
And
It has been made from that video only. The way I have
exactly,
done it, so it has been like written in that into that form. So even if you don't have that much time to go through the videos, just go through the notes and you will have that
exactly.
at a glance and it will be done, right?
Definitely,
Mm,
definitely, definitely. And in the basically in the exam, that is what I want to focus on. In the exam, see, you should have a very confident face at all times. That is one of the
mm.
most important things, because they are there to judge you. That is true, but they are
Correct.
not there to fail you deliberately. They'll fail you if you give
Right.
them a reason to fail you. If you keep a
Right.
confident face from the front, like a good morning, like you have said in your videos many times also, like greet them, enter the station, greet them with a smiley face. Look, even if the patient is in pain, even if you know that the patient is of an acute pancreatitis, you should greet the examiner. You should tell your exam number very confidently, so that they know, okay, the examiner also, straightens his back when they get a confident candidate in the front. And then be confident with the patient also, even if you do some small mistakes. Like, see, I have uh, one of my communication stations that was with the patient. It was the anxious mother one. And I know that I performed it like I just watched in your videos, and I know that I did it very well, because the mother sat down also. The mother listened to it very calmly, and I finished the communication station 1 minute before. So
Mm.
like you said, that if you do it nicely, even the communication stations will finish before time. So me and the
Right.
mother were like sitting there for 30 to 45 seconds, just looking at each other, because we had nothing else to do. So I know that I
Mm.
did it well. At the same time, on the other end of the spectrum, my communication with the consultant was not good at all, because I don't know, during the briefing of that RCS England Mumbai, they had said that we have cameras in every room. And I don't know what got into my mind. I had not made the trend of the investigations that were in the file. I don't know what happened. So when the examiner was asking me on the phone that what was the trend of the urine output, or what was the trend of the WEC, I did not have that. So I just kept on saying sorry, sorry, sorry on everything, because I genuinely did not write anything, and I had
Okay,
the file in the front. But
exactly. So why didn't you open that?
yeah, see, that is, sir, that is the problem. I so highly regretted it after the examination, that I
Right.
just know, it kept popping on my mind that there is a camera, there is a camera, there is a camera, and I did not open the file. So these things will happen with you. I was regretting it so badly. I even told it to my father and friends and whoever asked me about it, that I don't know what I did in that station. It was in front of me. Everything was there. I just had to open it and say, and I did not. And all I said was like you said it, be truthful, be honest, and I followed that. So I was like, I'm sorry, I did not write it. I'm sorry, I did not. Still, he asked me all the questions that are in your notes in that order itself. So I was like, okay, so these things are going to happen from this end of the spectrum to this end of the spectrum. Everything is going to happen to you in that exam, and everything is going to
Mm.
happen with everyone. So you don't have to get
Right.
disheartened about, just move on to the next station. Because
Mm.
1 minute of reading the stem and 1 minute of just revisiting everything, all the history points, is very difficult if you don't have a calm mind. If you just, if you're too stressed about the last station, you won't be able to remember what you have to ask in acute pancreatitis or what you have to ask in BPH. And you seriously need that 1 minute of stem reading to revise everything. So that is the main thing that I need to tell to everyone when they are giving the exam.
Brilliant, Dr. Navdeep. Okay. Thank you so much for your very nice uh, thoughts about this experience that you had, and you are now in a very nice place. About your score, you didn't mention about your score.
Yeah, I got 135 in knowledge and 142 in skills. So
Oh,
basically a
wow.
total of
That
277.
was excellent. Very, very, very good mark. Brilliant.
Thanks.
And without any doing any practice or without any partner,
Yeah, but
that's
seriously
that's a
credit
lot
to you.
within 3 months.
That,
Okay, one question.
yeah.
So for this last 3 months, how many hours? Because I get to these questions are quite a lot, right? Like how many hours I have to read if I want to see it after 6 months from now. So just to give a perspective to them, like how many hours you have studied in this last 3 months? Like
But
including watching the videos, like everything, inclusive of everything.
I see that is a basically that would vary because depending on the day and the duty that I have. But
Mm.
yes,
Mhm.
being an orthopedic surgeon, I kept the orthopedics a bit aside for this because I knew I only have 3 months, so I have to give my most of the time to my MRCS. That is how I could pass. I knew that. So I don't know. Basically, while driving back and forth, maybe 1.5 hour, I used to listen to your. That was a daily. That was a daily ritual. I like praying. It was like praying. Seriously, I had to do that because I know I did not have
Right.
much time at home also. So that I utilized. And back at home, maybe three hours, because I did not get much more than that. So that was a
Mm.
maximum. Maybe on Saturdays and Sundays, a half day and a full holiday, I used to study for a good, 5-6 hours on Sunday.
Mm.
So that was the main, that was there for 3 months. But yeah, that is the thing that we need to remember is that consistency is the main thing. You need to study
Mm.
daily, and you need to keep on
Mm.
revising whatever you have read.
One more thing I want to add with you is always there is a mindset of doing things. I think you are going to agree with that with me as well. Like you have to have a mindset of certain things that I want to do this and I want to pass this exam. So your thoughts, whatever you are doing, but your thoughts should be focusing into your exam. There is a certain mindset that you can set for yourself, right? So I think the mindset is also important. Suppose you want to give your exam after 3 months from now, so you have to put all of your thoughts into the exam instead of thinking something else during your leisure time. Am I correct about that?
Definitely,
So I
definitely,
think
and you.
like after hearing from you and also as you are sharing about that, I think you are that kind of a person that you have a certain mindset. Like, okay, in this 3 months or in this 6 months, I have to do this. So let's focus on this, finish it, and then let's move on for the next thing. Am I correct? Yeah.
Definitely, definitely, sir. And
Okay.
I'll share this with you also that when I joined
Hmm.
the course, you mentioned me that welcome to the IMG family, and you have to pass this exam. You said this just
Right.
like so. When
Right.
I passed, and so when I was studying for 3 months, and I used to open the chat box sometime, I used to see this message, and I made sure that when I pass it, and I will pass this exam, and when I pass this exam, I'll re-forward this message to you, and I'll write, "Sir, I have passed this exam," and I
Brilliant.
did that. I
Brilliant.
did that. I
Yes,
did that
I
same
saw
thing.
that.
I
Yeah.
just forwarded it. You have to pass this exam, and I read that. That was one of my
Right.
like goals that I have to do this because like you have
Brilliant.
like
Brilliant.
written it with such confidence in me, so I have to do that now.
Right.
And
Right.
you have to keep
So
on motivating yourself in between also.
correct.
Set up a
Correct.
wallpaper or a pop-up. Like I use an
Exactly.
app called as I use an app called as Forest, which lets me track time basically. So in that
Yes.
there are
Yes.
some
Yes.
messages that pop up and you can edit those
Hmm.
messages. So I've written it. I
Hmm.
have those edited messages that say you're going to be an MRCS soon, don't stop, part B incoming. So these are just small reinforcements
Right.
in your mind.
Correct, correct. So it is really fascinating to hear about all of these things, tiny things, but these are like, so important, and these are so powerful things in our day-to-day life. Like if you get demotivated, then you are not able to do it. You have to have a certain motivation to go for this exam and crack it. And I think you had the correct thing and you have done
Definitely,
your best. Okay,
definitely, definitely. There
brilliant
will
job,
be days.
Dr. Navdeep. Yeah.
Thank you.
So, yes. So, anyone wants to ask anything to Dr. Navdeep? Otherwise, like, if I want to continue the conversation, I think it will be like, passing the hours with you, right? Sometimes, like, when you have someone like the same, so you can talk for hours. So, I think you are just
Definitely.
like, we have something like
We will
similar.
do that,
Like,
sir.
we
We will
have
do
a
that.
certain,
Whenever you
we
want.
have sure, yeah. So whenever like you are that kind of a person that like as I said, let's fix a mindset, right? If
Definitely.
I cannot fix my mind, then I will not be able to do anything, no matter
Definitely.
what. Like I am like, no, it's a complete no. But once I set my mind and I'm going to do it, and then I'm going to do it like, and I will try to be as perfect as possible. Okay,
Definitely.
good, brilliant. So, anyone want to ask anything? One more thing, Dr. Navdev, very funny and a little bit things that I can share with you is one of the candidates asked me like, okay, before my exam, I keep a little bit of beard, so should I shave as a clean shave just before that, before going for the exam? I said no, so they will not bother about those things. So what do you think
Definitely.
about that? Like whatever,
No,
what should be
definitely.
your like look and all the gestures? If you can say something about that, like
See, I
the
feel
dress and the
if a
gestures. Yeah,
person is well trimmed and everything, that's up to
yeah,
them, and that's better also maybe. Not like completely clean shaven, like you said. People from our countries expect like बिल्कुल ही
mm, yeah.
complete shave करके आ जाओ, and like you don't look
See,
20
see,
years younger.
in
That is
our
not
in our exams, like in our previous medical life exams, like sometimes there wasn't that much trend of keeping the beard, right? In that time.
Hmm.
So the professor and the like other persons didn't like that. Like if you have like a goatee or something, the French one, so they didn't like all of those things. But the thing for the UK, it's not like that, right? They will
Exactly.
not bother
Exactly.
like whatever you have or what not. So if you
Exactly.
have any tattoo on your hand, it's fine, right?
Definitely.
So
Definitely.
yeah, even
As
like
long as you are
I
being
want to
respectful, as long as you've been
see.
respectful to them
Yes. So I
and to the
I want to
patient.
share and to the patient, yes. And then you have to be safe with them, right?
Exactly.
One thing, last one funny thing that I want to share with you as well, and with all the other candidates. I'm not going to share his name. So just before my exam, um, I have a tattoo. Okay, I have a tattoo in my right hand and also in my left hand. Okay, so see what happened is just before my exam, one of the candidates, he was a candidate as well for the exam, and he's from our country. So he all of a sudden see, and he was saying, "Oh, you have a tattoo? Then you're done." The examiner will not take it like very like in a good way. So you're not going to pass it. So yeah, that's you're done. And like, come on, like I was saying. Does it actually matters to the examiners and all that? And
Exactly.
he was like completely, he was saying, no, this is not like try to band your, like put a bandage before you go and you will say there is, I have cut my hands and please do that, brother, like otherwise you will be in like in danger. Okay. Like what? So different perspective, but like I have given my
Definitely,
exam and it was like, oh, well, I guess. So yeah, like
definitely.
it doesn't matter
I think
actually, right?
these things should matter when you have completed your
Taboos.
course like 6 to 7 times. After
Yeah.
that, you should think of
Yeah.
these things that, will this hurt, will that hurt?
Right.
I think the first thing should be to complete your course, to practice and to do
Correct.
like the things that are asked you to do, the main things. And then, we
Right.
should focus on these things, small things.
Hmm.
Exactly.
Right. Brilliant. Thank you so much, Dr. Navdeep, for your time
Thank
with us. Hopefully, of course, we will meet, inshallah, and we will keep in touch. And I
Definitely.
will request to all of our like candidates who have passed from IMGs, please help all the future candidates if you can, if you have any time. But I know it's difficult to track it after you pass the exam. It's barely will have the time to go back to the IMG main group and you give some time, right? I know like this will not happen, but if you can, or anyone, if they ask you to help, please do help others, okay? All right, so in this part I want to ask any of the candidates, if you have any queries to Dr. Navdeep, please ask now. If you have any queries, you are most welcome to ask. But like Dr. Navdeep, uh, I don't know why the people don't want to ask any questions during this, but they have lots of queries.
Like, they
Okay,
should. I think we
they
should
have a
keep,
lots of queries. Yeah.
definitely,
So
we should
one
keep
one
noting down.
one question I can ask as a simple question from on behalf of all the candidates. Nowadays, like the exam has changed, right? The exam has changed, like because in previously the anatomy pictures, all the anatomy pictures are there. It was the ditto same pictures that will come into the exam, whatever it was in the notes. But now the exam has changed, so they have changed the picture as well, right?
Exactly.
How they have changed? Why you are not finding all of those pictures in any of the notes? Why? Because in England they have a specific museum for the anatomy, right?
Hmm.
So they are going to take the just the pictures exactly from those models and they're going to put that into your exams. And that's why you cannot find any of the pictures
Exactly.
from anywhere. Before, they were taking some of the pictures from Macmillan's and some of the other books,
Hmm.
but now they have their own museum of it, right? And they are going to
Exactly.
take the pictures from those bodies. So you are not going to have those pictures until or unless some of the like these honest persons are going to take off some of those pictures and like share, right? So
Exactly.
uh, if I was in the candidates portion, then I should have asked like how you have coped with those images, the new images of anatomy. Was that a little bit similar? Was the questions were similar, or how you have cracked the anatomy part, especially where you don't have the similar images, whatever was there into our notes? How you have handled that question, Dr. Navdeep?
Before handling those, first of all, we need to have the required knowledge. So whatever is already there to be taught,
Mm,
we should read that very well. Then only we can,
mm,
go on to just use that knowledge to the complex things. So read, and revise and view those pictures like Macmillan's and everything again and again, and in as many views as you can. Because in Macmillan's also they for the lateral side of the neck also there are like 5, 6 pictures. So the more and more you see them, the more and more you correlate what is there, where is there. So, and at that point of time, even if you think that you have not seen this picture, that is not an issue because the examiner is going to get up and just say, okay, what is A? So at that point of time, I don't think that you will have the time, the candidate will have the time to just remember also, have I seen this picture or have I not seen this picture? That would be an instantaneous question with an instantaneous thought in your mind. So my what I used, and I think that was a spontaneous thought in my mind when I got the anatomy station was I just took 5 seconds, 5 to 10 seconds, and that is there is no problem in taking those 5 to 10 seconds. It is better to take those 10 seconds and just get an orientation in your head rather than giving a wrong answer or something that comes in your mind in the first place. So just take 10 seconds, get oriented with the model. They also don't expect you to answer in just a single second, a single go, like
mm,
come on, quick. They have those questions, list of questions, and when you identify that structure correctly, then you answer 3 questions automatically correctly, because the three following questions will be based on the label A.
Related. Yes, yes,
Yeah, so if
yes.
you don't answer that correctly, he will just move on to the 5th question, and 4 marks will be lost, or maybe whatever the 4, 6, whatever. So you have to take 10 to 15 seconds, take 20 seconds also, no problem. Get oriented to that model. Just calm down and think whether it is the lingual nerve or it is the marginal mandibular nerve, because in my case that was the model, and answer it correctly, and then you'll get the following questions and you'll gain 4 marks. So I think that is one thing that we have to do. We have to have a prerequisite knowledge of anatomy. We have to see the pictures that are already available in the portal and forum, and at that point of time, just forget about it. Don't try to remember that image. Just have, with a clear headspace, take 10 to 15 seconds to just identify what and orient yourself, and then answer, and that will be the best
Correct.
thing.
Right. Okay. Second question from the participants. If I was in their place, I would have asked you one more question is, as we have heard about something, new questions in different parts, especially in patho. Okay. So especially in patho, there are sometimes like new questions are coming. So what about that new questions? How you have handled those new questions, or does it actually affect your situation during your exams or not? What do you think about that?
New questions are, even I have heard that there are some new, especially like in patho, actinomyces is one of the new stations that has been there in the last few times. So if you get your hands on the new stations because you're reading the previous station list again and again and again of different stations, that's well and good. Read about it. If you don't have get your hands on, and if you sit there and you get a new question all of a sudden, just calm down and try to remember whatever you have learned in medical school, because we all are, the minimum criteria for MRCS is MBBS, and the minimum criteria for Part B is Part A clearance. So both those things combined, the previous knowledge will definitely be there somewhere or the other
Right.
inside the mind.
Right.
So we just need to be a bit calm and try to tackle it one question at a time. And if you don't know, just say that you don't know. Don't just blabber anything out. That will offend them more. Just say that you don't know, and I want to come back to this question later. And Dr.
Brilliant.
Atik, it actually worked for me, because many a times there will be questions in known topics also where we will just blank out, because it happened to me in that malignant melanoma. He asked me the types and I did not remember the 4th type. So he said there are 4 types, and I said, I'm sorry, sir, I'm not able to remember. Can we just please go on to the next question? That is it, simply. And he will go. That is what I'm saying. They are there to pass you. If you give them a reason to fail, then they will fail you. And they're very nice people. See, 1 or 2 people might be there who are a bit arrogant or rude or obnoxious. Just leave them, and they will be that for every person, not just to you.
Correct.
Many 90% of the examiners are very nice. So just tell them that you don't know, or think about it. Take 10-15 seconds to think about it. Do not try to answer it in a whim. That will always be wrong. Just take 10 to 15 seconds. They will also appreciate it. And in every station, just in the end ask, can I please come back to the questions that I did not answer? Even if you did not mention, okay, I just want to leave this question, in the end just mention this, can I please come back to the question that I did not answer? They will. It happened with me in around 4 of the knowledge stations. They went back through my paper and they said, no, you answered
Recheck.
most of the questions correctly, so
Recheck.
no need. We just recheck the
Right.
entire thing. So it happened in one station, so I was like, okay, why not try it? And I tried it in every station. I went on and said, can I please go back? Can I please go back? Can I please go back?
Right.
So,
Right.
and 1 or 2
Right.
even said that, no, you have done very good. You have done very good. No need. Okay, then no need then. So these things
Right.
are.
So it's if I want to conclude your thoughts, like, so it's always better to skip rather than to spend your time on that, whatever you don't know.
Definitely. And if you know, just take your time to form the answer in your head. Like, mostly the definition is the part that is the worst in this case. So if you don't remember the definition, you know it. You have read and you know it. Take 10 seconds, form the definition in your head, even though it is broken. And that is always like that. It is always broken. You can't remember exactly everything. And then say it. It will be much, much better. Because I think we get 9 minutes, and 9 minutes is a very long time. People don't seem to understand that.
Very long
9
time.
minutes is a
Yeah,
very
very
long
long
time
time.
for 20-25 questions. It is a very long time. And most of the
Right.
questions will be like 1 word or 2 word questions, which you have already
Two
read
words,
in
right?
between.
Short
Exactly.
sentences. Right.
Exactly.
So, last question is for the skill part. About the skill part, about the entire skill part, was it like, doable in time, irrespective of clinical examination, procedural skills, history taking, communication? Was it doable in the time in average?
History taking, I'll just tell it for me. Since I did it according to what you said, definitely before time, sir, at least 1 minute, I had to stare at the patient. The viva was complete,
Hmm,
the history was complete. So definitely
hmm,
to all the aspirants, sir's history taking is magical. And examination also, I did it, the magic notes and whatever you taught in the videos. Examination also, sir, got completed. And examination is a problem actually. Even if it does not get completed, it is not an issue at all. It is not an issue.
hmm,
They understand it. They understand. And you just need to mention it that I want to do this when you are explaining the case. That is all you need to do. And they will understand that
hmm,
it's okay. The all that is that you need to have a calm mind and you need to be respectful. Okay, I've not completed it, but I want to do this. Like you said in your videos also, that is not a problem.
right,
Skills
right.
part, sir. Skills is something that actually I fumbled a bit because it's the things that maybe we are taught also, and things that happen in the stations, they are sometimes they're very random also. And different colleges, different cities have different types of conducting the same thing. So I had
Hmm,
this IND, and I had the suturing of the wound. In the suturing also, I was searching for gloves, and then after like 10 seconds, he said that there are no gloves. You need to do it like this only. Consider your
in
hands
with a
are
bare
sterile.
hand. Yeah,
Yeah.
yeah,
So
yeah,
I
yeah,
was
yeah.
like, bro, what the hell is this? And then and because of while taking the knot also, I was trying, okay, I
Hmm.
should cross it and everything is coming and seeing and everything. So I got nervous and my scissors, they fell off the sterile area. So I just respectfully said, okay, I took the next knot and I asked him, sir, my scissors have fell in the unsterile area. I don't want to use it. Can I please get another pair of scissors? So he just said, yeah, take another pair of scissors. And I went there and took the scissors and kept them safely. So you need to be spontaneous at that moment of time. Just keep your calm. And again, if it does not get complete, no problem. Most of the times they'll ask you the questions while you're doing the thing, so you don't have you don't have to spare some time for the question answer round. I don't think that that happens. They'll keep on asking you while you're doing it only, and the patient will
Especially in
also
the
keep on
procedural
saying,
skills.
yeah, in the procedural skills, that is what, in the
Especially in the
procedural
procedural
skills,
skills.
while you're doing,
Right.
they'll keep on asking you. While you're doing, the patient will keep on interrupting you. But yeah, like you said
Hmm.
also, if you tell the patient yourself, that is always better. If you just keep on telling them. And that's about it. So in the IND also, I asked for the what all things are required. I asked for the swab also, but I forgot to use the swab. So the examiner pointed out to me that in the beginning you asked for one thing, but you haven't used that thing. So I remembered, okay, I used to take that swab culture and everything. So that
Hmm.
is all. So
Yes.
it's going to be okay. It's going to be okay. And if you don't complete it, don't worry. Just do every step. Do every step. Don't miss steps. That is all. If
Right.
start from
Right.
1 to 10. If you're not able to reach 10, that is okay. But 1 to 8 is pretty good. Pretty good.
Right. Right. Good. Excellent. So, lastly, Dr. Navdeep, is suppose one candidate just passed the MRCS Part A and he went to the YouTube for searching some of the videos. And of course, I'll be uploading these videos into the YouTube and I'll be sharing this with all of the other future candidates. So, for them, what message you want to give? What is the recommendations you want to give for them that they should follow?
That they should follow while like searching on YouTube. Uh,
No, I'm just saying like just a perspective, the way you have found the IMG, right? So
okay.
suppose some of the other candidates might be finding your videos just after passing the party and they are nowhere of knowing anything. So what are the recommendations or what are the like suggestions we want to give for them? Just as you have found this one, right? So what are the suggestions you want to give to them?
My suggestion would be that dive deep in the resources, try to find everything about the examination, because if you give like 2 days or 3 days just about knowing the examination, it will be much greater in the long run. Because if you find something new about it in like 1 month into the preparation, then you'll be like, oh, I should have done this like that. So like take 2-3 days, dig deep into the resources, download every book. It is no problem. 2 to 3. It just takes 2 to 3 days. Download each and every book, download everything, listen to everyone, and you will yourself see which is a better platform and which is not a better platform. But only if you listen to everything yourself. And obviously, if you have some trusted senior or a trusted elder brother who has done that, then well and good. It's very easy for those people, because they have a person to trust. But if like one of my seniors is giving part B now, so I've told them to have this IMG MRCS course, and he has already joined also. Dr. Aruj Shah, he has already joined. So like this, people will get to know that is all I have to say. But yeah, dig deep into the resources yourself. Don't listen to people just like randomly essay either hefty knowledge. Look at the books yourself. You will yourself see, because every person is different. In studying, one might like this book, one might like that book, one might like this video, one might like that. So
Correct.
do everything yourself. Try to do it yourself. It just hardly takes a week at max.
Right. Brilliant. So that was a excellent, honest answers that I was expecting from you. Brilliant, Dr. Navdeep. Okay, so thank you so much for your time within us, and I hope we will keep in touch, Dr. Navdeep. Okay,
Definitely, sir.
and good luck for your future. And I think I have already added you into the Hall of Fame of our IMG.
Yeah. Yes, sir. Yes, sir.
Yeah, just go through that, and I have already given some of the instructions. What are the things you have to go for the epics and the GMCs and all that stuff. And inshallah, there are like so many brilliant candidates are there who were already are in UK, got their jobs, they're doing the
Yes, sir.
things, right? So you will have a lots of insights and the helps from those future things. And inshallah, we will go through like in the future again for some of the future courses. Okay.
Definitely,
All
sir.
right, Dr.
Definitely.
Navdeep. Good luck.
Thank you
And
so much,
thank
sir.
you.
In the end, I just like to thank you again. Thank the entire team again. Thank you so much. It
You are
was
most welcome.
you were of great help, to be honest. And I just came here after work just to say this to you, and obviously help the candidates as well. But I waited all this while just to tell you like live. Thank you so much.
Thank you so much for your kind words, Dr. Navdeep.